My name is Emmeline Marden, and this is SDG number 1. For this presentation, I'm going to discuss how South Korea is working towards meeting Goal 3, good health and well-being. According to the UN, the goal of SDG 3 is to ensure healthy lives and promote well-being for all at all ages. To begin, I wanted to see what the leading causes of death were in South Korea, and then compare that with the United States. For this information, I looked at Our World in data, and as I compared the two, I noticed that cardiovascular diseases and cancers were both in the top 2 leading causes for both countries. Cancer is the number 1 leading cause of death in South Korea. And according to an article in Scientific Reports, more than half of cancer cases in the past 2 decades could have been prevented by applying current knowledge. The 3 causes of cancer in South Korea are attributed to smoking, alcohol, and lifestyle behaviors. Smoking contributes to 22.7% of cancer deaths and 11.8% of new cancer cases in South Korea. Alcohol. In 2018, 60.6% of adults drank alcohol, with excessive drinking reported by 50.8% of men and 26.9% of women. Lifestyle behaviors. By 2020, 54.4% of adults and 94.1% of adolescents were not getting enough physical activity. The rate of sufficient aerobic activity dropped from 58.3% in 2014 to 45.6% in 2020. Additionally, from 2009 to 2018, both obesity and abdominal obesity increased steadily among adults. I then chose to look at another chart to determine what the risk factors were. The number 1 risk factor for South Koreans in 2021 was smoking, followed by high blood pressure and high blood sugar. Last year, South Korea released their progress report detailing where they are at in meeting their Sustainable Development Goals. As you can see for goal number 3, they're currently at 95%. As you can see on the slide, they have made significant improvements in meeting their goals, with only a few areas of improvement left. Those are maternity mortality rate, age standardized death rate due to household air pollution and ambient air pollution, and surviving infants who receive 2 WHO recommended vaccines. The relatively high maternal mortality rate can be explained by young Korean women postponing getting married and having children to pursue their careers. This is leading to an aging maternal population, which then results in high cesarean rates and gaps in postpartum care. For the age standardized death rate due to household and ambient air pollution, this is due to poor air quality contributing to respiratory illnesses and increased mortality. While the vaccination rates are still very high in South Korea, there are still concerns that the poor and underrepresented communities are not receiving the 2 WHO recommended vaccines. Smoking and excessive alcohol consumptions are prevalent with public health issues, and they are contributing to high rates of cancer and liver diseases. The increasing obesity rates is putting more strain on their healthcare system, which is causing delays and preventing early detection, which is then leading to chronic conditions such as diabetes and heart disease. And with the persistent suicide crisis, it is being driven by the societal pressures, mental health stigma, and lack of sufficient support, particularly among youth and the elderly. I believe that IoT can help South Korea meet their SDG number 3 by 4 different ways: wearable devices, sensors, smart health, and connected systems. For wearable devices, IoT-enabled devices can continuously monitor health information and provide real-time data to healthcare providers. This could help with chronic conditions, improve the maternal and infant care, and help support those who are suffering from mental health crisis. Sensors would be great to use to provide real-time data on air quality and environmental conditions. This can also help manage health risk and diseases that are caused by air pollution. Smart health systems can use IoT to integrate data across the healthcare facilities, which could improve patient care and reducing errors. And then for connected systems, telemedicine and remote monitoring can provide healthcare to the most vulnerable and those that cannot travel. This can improve the patient-doctor relationships and help with early intervention of lifestyle concerns like smoking and drinking. This wraps up the presentation. Please feel free to comment and ask questions. If you would like to find out any more information about what is provided, you can visit these links. Thank you.